Have you ever stepped out of the shower feeling clean, only to notice an itch, a strange odor, or irritation later in the day? Maybe you assumed it was just dry skin, sweat, or simply another normal part of getting older. The truth is, your body at 70 does not behave exactly the way it did at 40 or 50. Skin gradually becomes thinner, drier, and more delicate. The body's defenses may not respond as quickly as they once did. There is another problem few people think about. Some parts of the body naturally trap more sweat, moisture, dead skin, and debris than others. When those areas are quickly rinsed but not carefully cleaned and dried, they can create an environment where irritation, fungi, or bacteria are more likely to become a problem. What makes this easy to miss is that the warning signs often begin quietly. A little redness, a small crack in the skin, an itch that comes and goes, a faint odor that returns even after bathing. They can seem too minor to worry about, so they are often ignored. In this video, we're going to focus on 3 body parts that are easy to neglect after 70. Caring for them properly may help prevent irritation, rashes, infections, and discomfort. More importantly, one of these areas can be forgotten, even by people who shower every single day. And make sure you stay with me until the final area, because it may be the most surprising of all. It's a tiny part of the body that many people assume gets cleaned automatically every time they shower. But after 70, changes in the skin and body can make it easier for moisture, dead skin, and debris to remain trapped there without you noticing. The first warning sign may be nothing more than a little itching or an unusual odor, but by then, the problem may already have been developing quietly for some time. Before we begin, if health information for older adults is useful to you, subscribe to the channel and turn on notifications so you don't miss our next video. And tell me in the comments, how old are you and where are you watching from? I enjoy seeing how far this community reaches. Now let's begin today with number 3. Your feet. Most of us think of washing our feet as a simple hygiene task. Water runs over them in the shower. Perhaps we rub a little soap across the top, and we assume the job is done. But after 70, your feet deserve much more attention than that. They are not only another part of your body to keep clean. They are the foundation of your mobility, balance, and independence. Every time you get out of bed, walk to the kitchen, climb a few steps, shop for groceries, or go outside for fresh air, your feet are carrying you. And when something goes wrong with them, even a problem that begins with a tiny crack or a little itching can eventually make every step uncomfortable. Aging changes the feet in several important ways. Circulation to the lower legs and feet may become less efficient. The skin often becomes thinner, drier, and easier to damage. Small cuts and cracks may take longer to heal. At the same time, the immune system may not respond to infection as quickly as it did years ago. For people living with diabetes, peripheral artery disease, or neuropathy, these changes can be even more important. Reduced sensation may make it difficult to notice a blister, cut, or sore. Poor circulation can then make that injury slower to heal. This is why something that looks insignificant should not automatically be ignored. One common example is athlete's foot. Fungi thrive in warm, damp places, especially between the toes. It may begin with itching, peeling, redness, or cracked skin. Dry heels create another problem. When the skin becomes very dry, deep fissures can form. Those openings can become painful and may allow bacteria to enter. In some cases, an untreated wound can develop into an ulcer or a bacterial skin infection, such as cellulitis. Consider George, a 75-year-old retired teacher who had always been active. He still drove himself to the store, worked in his garden, and took a short walk most mornings. So when his heels became unusually dry and he noticed occasional itching between 2 toes, he wasn't concerned. Weeks passed. A crack on one heel became deeper, but because George could still walk, he continued to ignore it. Then the area became sore and increasingly red. Eventually, walking in his usual shoes became painful enough that he made an appointment. What had started as dry, damaged skin had developed into a wound that needed medical treatment. George recovered, but the experience changed the way he thought about his feet. He realized that protecting his independence sometimes begins with noticing problems while they are still small. So, what should you do? Start with a daily inspection. Before putting on your socks in the morning or before going to bed, take a few seconds to look at both feet. Check the heels, soles, toes, and especially the spaces between the toes. Look for redness, swelling, blisters, cuts, cracks, sores, or changes in color. If bending down is difficult, use a mirror or ask someone you trust to help. Next comes washing. Use comfortably warm water and a mild soap. Don't simply let shower water run over your feet. Gently clean around the toes, along the soles, around the nails, and anywhere sweat and debris can collect. Avoid very hot water, particularly if you have reduced sensation in your feet. Then take the time to pat your feet completely dry, especially between every toe. Leaving those narrow spaces damp creates exactly the kind of environment fungi prefer. You don't need to scrub. Gentle and thorough is better. If the skin on the tops, soles, or heels is dry, a suitable moisturizer can help keep it from cracking. But don't routinely put moisturizer between the toes, where extra moisture may encourage fungal growth. Your socks and shoes matter too. Wear clean, dry socks and shoes that fit properly without rubbing or squeezing. Shoes that are too tight can create pressure points and blisters, while damp footwear can encourage fungal growth. If possible, allow shoes to dry between uses. Toenails also deserve attention. Keep them appropriately trimmed, and don't aggressively cut into the corners or surrounding skin. If your nails are very thick, discolored, difficult to reach, or difficult to trim safely, getting help from a podiatrist or another qualified professional may be safer than struggling with them yourself. Most importantly, know when home care is no longer enough. A wound that isn't healing, increasing redness or swelling, warmth, drainage, significant pain, or a sudden change in skin color deserves medical attention. If you have diabetes, poor circulation, or reduced sensation, it is especially important to discuss foot problems promptly with your healthcare professional. This may sound like a lot, but the daily routine itself can take only a few minutes. Look, wash, dry, moisturize the appropriate areas, and put on clean socks and properly fitting shoes. Those few minutes are not just about having cleaner feet. They are about protecting the feet that allow you to stand up without fear, walk through your own home, visit friends, go shopping, enjoy your garden, and continue doing things for yourself. Because after 70, independence is often protected through very ordinary habits. And caring for your feet is one of them. But the next area is even easier to neglect. Many people avoid thinking about it because its private, yet warmth, friction, and trapped moisture can turn it into one of the body's most uncomfortable places when daily care is overlooked. Number 2 is the groin area. This is a part of the body many people don't like talking about. It's private, sometimes embarrassing, and easy to assume that a normal shower takes care of everything. But after 70, the groin deserves deliberate daily attention because it combines 3 things microorganisms love: warmth, moisture, and skin folds. And unlike an itchy arm or a dry hand, problems here are often hidden under clothing. That means irritation can quietly worsen for days before anyone takes a close look. As we age, the skin becomes thinner and more fragile. It may also form deeper folds, particularly around the inner thighs and lower abdomen. Sweat can remain trapped where skin touches skin. If walking, bending, or reaching has become more difficult, cleaning and drying those folds thoroughly may also become harder. Then there are other factors that many older adults deal with, but rarely discuss. Occasional urinary leakage can leave the area damp. Adult briefs or absorbent pads can trap heat and moisture against the skin when they aren't changed frequently enough. Tight underwear and non-breathable clothing can make the environment even warmer. Diabetes and excess body weight may further increase the likelihood of skin problems or infections in these moist areas. One common condition is called intertrigo. It develops in skin folds, where moisture and friction repeatedly irritate the skin. At first, you may notice only redness or tenderness, but once the skin barrier becomes damaged, yeast such as candida or other microorganisms may have an easier opportunity to grow. That can lead to itching, burning, soreness, scaling, or a persistent rash. And this is where embarrassment can become part of the problem. Some older adults notice an unusual odor or irritation, but don't tell anyone because they feel uncomfortable discussing such a private area. They may assume it's simply something that happens with age. But persistent odor, itching, pain, or a rash should not automatically be accepted as normal aging. Margaret learned this at 82. She lived independently and took great pride in looking after herself. She bathed regularly, changed her clothes every day, and believed her hygiene was perfectly adequate. But one summer, she began noticing a faint odor from her groin area. At first, Margaret blamed the hot weather. She washed more often, but the odor kept returning. Then she began experiencing mild itching. Because the problem felt embarrassing, she didn't mention it to her daughter, and certainly didn't want to make a doctor's appointment just to talk about an odor, so she waited. Over the following days, the itching became more persistent, and the skin began to feel sore when she walked. Eventually, the discomfort became difficult to ignore. When Margaret finally spoke with a healthcare professional, she learned that moisture had been remaining inside one of the skin fin folds in her groin. The irritated area had developed a mild fungal infection. Fortunately, it was identified before becoming more serious, and with appropriate treatment and changes to her daily hygiene routine, the problem improved. But Margaret took away an important lesson. She had been washing the area, yet she hadn't been drying it thoroughly. For daily care, start gently. Use comfortably warm water and a mild, unscented cleanser if needed. Carefully wash the external groin area and skin folds without aggressive scrubbing. Older skin can be delicate, and scrubbing harder does not necessarily mean cleaning better. In fact, excessive friction can create more irritation. After washing, rinse away any remaining cleanser, then dry the area completely. Use a clean, soft towel and pat rather than rub. Pay particular attention to places where skin rests against skin. If reaching the area is difficult, sitting safely while drying may make the process easier. The goal is simple. Don't allow persistent dampness to remain hidden inside a fold. If urinary leakage is an issue, moisture management becomes even more important. Change damp underwear, pads, or briefs promptly, rather than leaving them against the skin for long periods. Follow any skin protection routine recommended by your healthcare professional, especially if irritation occurs repeatedly. Clothing also makes a difference. Choose comfortable underwear that allows airflow and doesn't dig tightly into the skin. Change it every day, and sooner if it becomes damp from sweat or leakage. Loose, breathable clothing can reduce the combination of heat, friction, and moisture that contributes to irritation. And once a day, take a few seconds to pay attention to the skin itself. Is there new redness, a rash, cracking, unusual moisture, persistent odor, itching or burning that wasn't there before? You don't need to become anxious about every minor change. But you do need to notice when something isn't improving. Alert rash, broken skin, swelling, discharge, significant pain, spreading redness, or signs of infection should be discussed with a healthcare professional rather than repeatedly treated at home without knowing the cause. This is particularly important if you have diabetes, circulation problems, or a weakened immune system. And there is absolutely nothing embarrassing about asking for help. Doctors and nurses deal with these problems regularly. To them, it is skin that needs care. Waiting because of embarrassment can turn a manageable problem into one that is far more uncomfortable. The larger lesson here isn't about smelling perfect or meeting some unrealistic standard of cleanliness. It's about comfort. When the skin in your groin is healthy, dry, and free from irritation, walking is easier, sitting is more comfortable. Sleeping is less distracting. You don't spend your day worrying whether someone else notices an odor. You simply feel more at ease in your own body. That is why caring for this area after 70 isn't about vanity. It's about dignity, confidence, and protecting the skin that allows you to move through your day comfortably. And now we come to number 1. This final area is dramatically smaller than your feet or groin. In fact, you can clean it in less than a minute. Yet many people who shower every day rarely clean inside it intentionally. Because of its shape, moisture, dead skin, lint, and debris can remain hidden there long after the rest of your body is dry. And for some people, the first clue that something is wrong isn't what they see. It's what they smell. And now we come to number 1. Your belly button. Think about your normal shower routine. You wash your face, under your arms, across your chest, down your legs, and perhaps carefully clean your feet. Water and soap run across your abdomen, so naturally, you assume your belly button gets cleaned too. But does it? For many people, especially those with a deeper belly button, water passing over the surface doesn't necessarily clean what is sitting inside. Your belly button is essentially a small pocket in the skin. Depending on its shape and depth, it can collect sweat, dead skin cells, tiny fibers from clothing, traces of soap, natural skin oils, and everyday debris. Add a little moisture that doesn't fully dry, and you have a warm, enclosed space where irritation and microbial growth can become more likely. As the body changes with age, the skin around the abdomen may become looser and form additional folds. For some people, the belly button may appear deeper or become more difficult to see clearly. If arthritis, back stiffness, reduced flexibility, poor eyesight, or balance problems make bending and reaching more difficult, cleaning inside this small pocket can easily disappear from the daily routine. That's why someone can be extremely clean overall and still neglect their belly button without realizing it. The shower isn't necessarily the problem. The assumption is. If you've never intentionally cleaned and dried your belly button, think about the last time you actually looked inside it. For some people, it may have been months. The good news is that most of the time, there is no reason to panic. A belly button doesn't need aggressive scrubbing, harsh disinfectants, or complicated products. But it does benefit from gentle cleaning and, just as importantly, thorough drying. Problems often begin with very subtle signs. Perhaps you notice a faint odor when changing clothes. Maybe the skin around your belly button looks slightly red. You might feel a little itch that comes and goes, or notice that the inside feels damp or sticky even though the rest of your body is dry. You may think the itch comes from your waistband. You may blame the redness on dry skin. You may assume the odor is simply sweat. Often, those explanations may be harmless. But when symptoms persist, especially when several appear together, the area deserves a closer look. Peter discovered this at 79. If you had met Peter, you probably would have described him as exceptionally well-groomed. He showered every morning. His clothes were always clean. He shaved regularly, kept his nails trimmed, and took pride in looking presentable, even when he had nowhere special to go. Hygiene was not something Peter neglected. At least, that's what he believed one afternoon. He noticed a mild itch near his belly button. It wasn't painful, and there was no obvious wound, so he ignored it. A few days later, the itch returned. Peter assumed his waistband was rubbing against his skin. He changed trousers and thought nothing more about it. But the irritation didn't completely disappear. Then one morning, while getting dressed, he noticed something else. A faint, unusual smell. That caught his attention. He showered again and carefully washed his abdomen. By evening, however, the odor seemed to return. This time, Peter looked more closely. Inside his belly button, the skin appeared irritated and slightly moist. When the symptoms continued, he finally mentioned them to his healthcare provider. The area was examined, and Peter learned that moisture and accumulated debris had created conditions that contributed to a yeast-related skin infection. Peter was surprised. How could that happen? He wondered. I shower every day. And that is exactly the point. Being clean does not always mean every small fold and crevice of the body is being cleaned effectively. Peter hadn't done anything intentionally careless. Water had washed over his stomach every morning for years. He simply hadn't realized that his belly button needed to be cleaned and dried as its own small area. Once the problem was properly identified and treated, Peter changed one tiny part of his routine. It took less than a minute. Here is a simple way to think about belly button care. First, clean it gently. During your shower or regular wash, use warm water and a small amount of mild, fragrance-free cleanser if needed. For a shallow belly button, your fingertip or the corner of a soft washcloth may be enough to gently clean the area. If yours is deeper, the goal is still gentle cleaning. Not digging, scraping, or forcing anything deep inside. The skin there can be delicate, especially in older adults. Aggressive rubbing can cause irritation or tiny breaks in the skin, creating exactly the problem you're trying to prevent. Remove any visible lint or debris carefully, then rinse away the cleanser. This step matters because soap residue left inside a deep belly button may itself contribute to irritation. What you want afterward is a clean area without cleanser or debris sitting in the folds. Now comes perhaps the most important part. Dry it completely. Many people clean the belly button and then immediately get dressed while it is still slightly damp. That can defeat much of the purpose. A warm, dark, damp pocket underneath clothing creates an environment where yeast and bacteria may thrive more easily. So after bathing, gently pat the belly button dry with a clean towel or another clean, soft material that can reach the area without causing irritation. Don't rub aggressively. Don't leave it wet. Clean and dry is the goal. For someone with a particularly deep belly button or abdominal skin folds, it may help to check the area after bathing to make sure moisture isn't trapped inside. And this brings us to another important habit. Look at it. You don't need to inspect your belly button obsessively, but every so often, especially while washing, notice what is normal for you. Is the skin its usual color? Is it dry? Is there any unusual smell? Is there new itching, soreness, swelling, or discharge? Knowing what your belly button normally looks and feels like makes it easier to notice when something changes. And some changes should not be ignored. Persistent redness, increasing pain, swelling, bleeding, significant tenderness, unusual or foul-smelling discharge, or symptoms that continue despite gentle cleaning and drying are reasons to speak with a healthcare professional. Don't repeatedly scrub the area harder hoping the problem will disappear. And don't automatically assume every rash is fungal and treat it yourself indefinitely. Different skin conditions can look similar, and proper treatment depends on knowing what is actually causing the problem. This is particularly important for older adults with diabetes, impaired circulation, a weakened immune system, or a history of abdominal surgery. If something looks wrong or isn't healing, getting professional advice early is usually wiser than waiting for it to become more uncomfortable. Peter's experience teaches us something larger than how to clean a belly button. It shows how aging can change the details of self-care. For decades, you may have showered in exactly the same way and never had a problem. But the body you care for today isn't identical to the body you had at 30, 50, or even 60. Skin changes, mobility changes, body shape changes, and sometimes your routine needs to change with it. That doesn't mean you need a complicated hygiene schedule. It doesn't mean scrubbing yourself constantly or worrying about germs everywhere. In fact, the lesson is almost the opposite. Pay attention to the small places. Your feet may require extra attention because they carry you through the world. Your groin requires attention because warmth, friction, and moisture can become trapped there. And your belly button deserves attention, precisely because it is so small that it's easy to forget. 30 seconds of gentle care can be more useful than assuming running shower water has done the job. So tonight or tomorrow morning, when you bathe, take a moment to look at your belly button, not because you should expect to find something wrong, but because you now know it is there. Clean it gently, rinse it, dry it completely. And if you notice a persistent change, don't be embarrassed to mention it to a healthcare professional. A tiny part of the body can still create a surprisingly large amount of discomfort when it is neglected. And sometimes, protecting your health after 70 doesn't begin with an expensive product, a complicated treatment, or another bottle in the medicine cabinet. Sometimes it begins with noticing the places you've stopped noticing. Now I'd love to hear from you. Which of these 3 areas surprised you the most? Your feet, your groin, or your belly button? Share your answer in the comments. Your experience may help another person watching today. And if you found this video useful, please give it a like, subscribe to the channel, and turn on notifications. We share practical information designed to help older adults live more comfortably, confidently, and independently. Take good care of yourself, and I'll see you in the next video.